Welcome to Science-Based Health. This is evidence straight from medical textbooks, no fakes. Today, we explore what alcohol really does to your body and brain. Alcohol is the most widely used drug in the world. It touches almost every organ. Even small amounts can worsen existing health problems. Heavy use can shorten life by 10 years or more. What counts as a drink? One standard drink has about 10 to 12 grams of alcohol. That equals a small can of beer, or a single glass of wine, or one shot of spirits. A pint of spirits contains about 16 drinks. A bottle of wine has about 5 to 6 drinks. Many people underestimate intake because servings are often larger than one standard drink. Absorption in the body. Absorption means how alcohol moves into your blood. A little enters through the mouth and stomach. Most enters through the small intestine. Carbonation speeds this process. Food slows it down, especially fat or protein-rich meals. The liver is the main organ that breaks down alcohol. A small part leaves through breath, urine, and sweat. This is why police use breath tests to check alcohol levels. Metabolism in the liver. The breakdown happens in two main steps. First step, alcohol dehydrogenase. This is an enzyme, a protein that speeds up chemical reactions. It converts alcohol into acetaldehyde. Acetaldehyde is toxic. It causes flushing, nausea, and contributes to hangover. Second step, aldehyde dehydrogenase. This enzyme changes acetaldehyde into acetate. Acetate is less harmful. Your body can use it for energy. Calories and vitamins. One drink has 70 to 100 calories, but it has no protein, no vitamins, and no minerals. These are called empty calories. Alcohol blocks absorption of key vitamins. Folate, needed for healthy blood cells. Thiamine and B6, needed for the brain. Niacin, needed for energy. Vitamin A, needed for vision and skin. Heavy drinking depletes them all. Drinking heavily while fasting can cause blood sugar to fall. Brain effects. Alcohol changes chemical signals in the brain. It boosts GABA. GABA is a calming messenger that slows activity. It weakens glutamate. Glutamate is an excitatory messenger that increases activity. With long-term drinking, the brain adapts. This explains withdrawal symptoms when drinking stops. Alcohol also raises dopamine, the reward chemical. It increases cortisol, the stress hormone. It alters serotonin, which affects mood. It boosts endorphins, which give relief and pleasure. It also changes nicotine and cannabinoid systems tied to habit and stress. Behavior and tolerance. Even small amounts affect judgment and coordination. At very high levels, alcohol can cause coma or death. Tolerance develops after weeks of use. The liver speeds up metabolism. The brain adapts. Behavior compensates. But tolerance is not protection. Very high doses remain dangerous. Withdrawal begins when drinking stops suddenly. It peaks in 5 days. Sleep problems and anxiety can last months. Nervous system problems. Blackouts are memory gaps during drinking. 1 or 2 drinks at night disrupt sleep cycles. They reduce deep sleep and worsen snoring or sleep apnea. Chronic drinking damages nerves. This causes pain, numbness, and weakness. It can shrink the cerebellum, the brain's balance center, This leads to unsteady walking and rapid eye movements. Thiamine deficiency may cause Wernicke-Korsakoff syndrome. This is confusion, poor balance, and severe memory loss. Brain shrinkage is common, but may improve with abstinence. Mental health effects. 2/3 of people with alcohol disorders also have another mental health problem. Some are independent, like bipolar disorder or PTSD. Others are caused by alcohol itself. These include anxiety, low mood, and sometimes psychosis with hallucinations. Most improve within weeks of not drinking. The earlier people stop, the better the recovery. Gut and liver problems. Alcohol irritates the esophagus and stomach. It can cause pain, bleeding, and gastritis. Repeated vomiting may tear the lining of esophagus. This is called a Mallory-Weiss tear. Alcohol can inflame the pancreas, which makes insulin and digestive enzymes. It damages the liver, first with fat, then hepatitis, then cirrhosis. Cirrhosis is scarring of liver that can lead to liver failure. Cancer risk. Even small amounts raise cancer risk. 1.5 drinks daily increase breast cancer risk. 4 drinks daily triple the risk of oral and esophageal cancer. 7 or more drinks raise risks 5-fold. The main culprit is acetaldehyde, the toxic byproduct of alcohol breakdown. It damages DNA and weakens immunity. Blood and immunity. Alcohol enlarges red blood cells. It lowers white blood cells. It weakens the immune system and raises infection risk. It can lower platelets, the blood cells that help clotting. This often recovers within a week of abstinence, unless there is cirrhosis. Heart and circulation. Small amounts may briefly lower blood pressure, but 3 or more drinks daily raise blood pressure long-term. This usually normalizes after weeks of not drinking. Chronic heavy use damages the heart. It can cause cardiomyopathy, a weak and enlarged heart. It can trigger arrhythmias or abnormal rhythms. It can lead to heart failure. Holiday heart describes sudden arrhythmia after binge drinking, even in healthy people. Reproduction and pregnancy. In teens, heavy drinking disrupts sexual development. In men, it can shrink testes and lower sperm counts. In women, it can stop periods, reduce fertility, and increase miscarriage. In pregnancy, alcohol crosses the placenta. It causes fetal alcohol spectrum disorders. The severe form, fetal alcohol syndrome, leads to brain damage and facial changes. No safe level is known in pregnancy. Treatment. Doctors focus on abstinence, supportive care, and therapy. Cognitive behavioral therapy teaches coping skills. Short-term medications may treat psychosis or withdrawal. Most alcohol-induced conditions improve within weeks of stopping. The earlier people stop, the better the recovery. Alcohol is harmful to almost all systems of your body. It can mimic disease, worsen problems, and damage nearly every body system. If you recognize these patterns in yourself or others, seek medical help. This is Science-Based Health. Subscribe for more evidence-based deep dives.